Suicide is a topic that people often don't talk about or is misunderstood, but in recent weeks, the death of comedian Robin Williams has thrust suicide and depression into the national spotlight. And with us this week at our roundtable is Deb Jurdo from Saranac Lake, whose son Joshua ended his own life at the age of 23 a few years ago by suicide. She is also one of the organizers of the Out of the Darkness Walk that will be happening in Lake Placid this coming weekend, and we'll talk more about that in just a moment. Also with us, Laura Marks is the area director for the Capital Region chapter of AFSP, which is the American Foundation for Suicide Prevention. Sean Larrabee is the program director for the Colby Senior Behavioral Health Unit at Adirondack Medical. And also Ashley Hart is the outreach coordinator for North Star Family of Services based in Malone, New York. Welcome to you all. This is coming up now on the 6th year that you have held the Out of the Darkness Walk. The idea when these started was to get people talking about this.
Yeah. There's a couple of purposes for the walk. So it's raising awareness. When you show up at a walk and there's 400, 500, we just had a walk in Albany with 1,800 people, it gets noticed. So you have people wearing their team shirts with the person that they've lost. That all brings awareness to the cause. The third purpose is it's a fundraising event. And so the money that we're raising goes to two really important things. The first is research. So that research is showing us what programs we need in the communities, what services do people need, what medications, things like that, that we can bring directly back to our communities. And the other is education and prevention programs and support for survivors. So that money stays locally to go back into the community, to go into schools, to do programs like More Than Sad, which is a depression awareness program, to bring support groups to survivors, all different kinds of programs that can help people not only prevent suicide, but help those who've been through a loss.
Because there was such a stigma attached for so many years, were there not really programs or assistance to help? Oftentimes was it not addressed and not looked at because people didn't talk about it and there was that stigma?
Well, and there's still a stigma. We're working to reduce that, but there certainly is still a stigma that exists, and that's really what prevents people from getting help if they find that they're having trouble with depression or mental illness. There's lots of things that go along with that. There's a lot more, over the years there's more research being done, so we know what programs people need. We know how to connect them to resources in the community that already exist that they may not know are there.
Deb, for 6 years you've organized these walks. How has that helped you and your husband Doug and the family?
It's really been, it's been a good thing for us, coming together with other survivors that know what you're going through, what you have to deal with. There's healing in that. Also bringing awareness and knowing that it is making a difference by saving other people's lives. It helps tremendously.
You get hundreds and hundreds of people turning out for the walk now.
Yes, it's a good thing. And also we've actually expanded and we have offshoot walks. We have campus walks. There's a campus walk in Plattsburgh at SUNY Plattsburgh. We're happy about that because that's the whole mission.
Suicide is the second leading cause of death on college campuses.
Has there been, in recent years, more of a focus on not only suicide prevention, but also some of the root issues that lead to depression and mental illness?
Absolutely. At Adirondack Medical Center, we've really tried to transform our behavioral health unit in making sure that we're open to bringing in more folks. Initially, when our behavioral health unit opened, we only admitted patients age 65 and older. We have now lowered that age down to we're admitting patients age 50 and older.
Obviously, this is an issue that affects seniors as well.
Absolutely. Suicide is actually in the county that we're in Franklin County. Suicide amongst patients age 50 and older is the 5th leading cause of death.
And Ashley, as far as your agency, do you deal with all ages?
Yes, we do. And we're actually on two fronts. We're really trying to engage in prevention. The first front is that we currently offer open access appointments at both of our clinics, which are walk-in appointments. So at any time someone may be in crisis or has a family member in crisis, they can walk right into our clinic and get services immediately. The second is that we have an on-call crisis line where people can call our normal business numbers, both in Saranac Lake and Malone, and they will get connected directly to a crisis line and be able to speak to a counselor, and if needed, connected to the available appropriate services. We're really trying to educate the general population about the warning signs and risk factors for suicide. We have a whole educational component in several of our local school districts with our prevention workers and school counselors. We've also started facilitating mental health first aid to learn about mental illness, depression, and specifically about the warning signs of suicide and the risk factors. But I think sometimes people are hesitant to intervene if they see someone in crisis. If there is an on-call line, call that. If not, get them to the hospital as soon as possible.
Don't leave them alone. Escort them to where they need to go so they can get the help that they need. If there's resistance from those people, police can be of great assistance.
You folks have actually made changes in how you deal with patients coming in who are suicidal.
A few years back, we had some patients that were successful in completing suicide, and we changed how we approached somebody who came to our hospital seeking help for depression and having suicidal thoughts. We wanted to make sure that we treated these patients just as quickly and with as much skill as a patient that came into the emergency room having a heart attack. We wanted to change the stigma, again, just from our standpoint, from a healthcare standpoint, that suicide isn't as suicide thoughts isn't as important as a heart attack, but when in reality it very much is. So we have really changed how we focus on on patients coming in.
Are we seeing more and more cases of budget cuts, closing mental health facilities that can help people with depression and who may be suicidal, and are more and more people turning up at the hospitals and in emergency rooms?
Absolutely. I think that one of the biggest struggles that we have is finding open bed placement for patients who require inpatient treatment. There just aren't enough beds.
We talked a little earlier about Robin Williams' death. The fact that he was so well known, such a recognizable face, such a celebrity, having that in the national spotlight for so many weeks, has that been beneficial?
You know, I think people were shocked because he always made everyone else laugh. So someone who is so funny, how could they be so sad inside? And so it did open people's eyes to the fact that what you're seeing on the outside may not be what they're really feeling.
The walk is this coming Sunday, October 5th at 1 o'clock.
Yes.
Beginning on the Oval, and
Yes.
right near the Olympic Center.
We encourage online registration, afsp.org, and click on Community Walks, and from there it'll just walk you through, find the North Country Walk.
So you get a lot of help. A lot of volunteers help you with the Out of the Darkness walk, and there's one in particular.
Yes. A big thank you to our chair this year, who is Linda McClargan. She's the Chief Nursing Officer at Adirondack Medical Center. And I really want to thank her.
And she has helped you not only organize the walk, but it sounds as if she's gone above and beyond that.
Oh, yes. Yes, we know she does much at Adirondack Medical Center, but she's just been a wonderful asset this year.
And Deb, for you and your husband Doug, has this helped you in many ways by becoming advocates?
For sure. I can tell you 100% yes.
And you folks, by opening the clinics, both in Saranac Lake and Malone, you're trying to get to people sooner.
Yes.
Perhaps intervene before they end up in the emergency room.
Absolutely. Yep. With our walk-in appointments, we're trying to get them into treatment earlier, recognize warning signs earlier, and get them the help they need.
And are people turning to you? Are you seeing your caseload increasing?
Yeah, the walk-in appointments are utilized, regularly, but we're also finding we currently have an early recognition program. We spoke earlier about people who are suffering from depression, recognizing those signs earlier. And we are actually working with several local pediatricians to screen adolescents and youth for signs of behavioral health concerns so that we can have them in treatment earlier, because the evidence-based outcome is that those who get treatment earlier have better chances of recovery.
I know there have been some programs in recent years here in the Clinton, Franklin, Essex County area, Safe Schools, where a lot of that was being done in the schools. Are programs, as they're being either cut back or eliminated, is there the risk that programs that may be able to do that and advances that may be able to find those at-risk students right within the schools are being eliminated, and does that create a problem?
We're finding that our services in the schools are being utilized more and more, creating a further need for them. We're currently, as I mentioned before, we have prevention workers and school-based counselors in several local districts who are facilitating the Signs of Suicide program, but they're also seeing youth directly in the school system for services. So we're finding that they're being utilized and used.
Along with the Out of the Darkness walks, you obviously do a lot more.
Right, so I mentioned before some of the programs that we do in the communities. One of the other things that we also work on is advocacy, both on a federal level and a state level. One of the things that we're really proud of is last June in Washington, we advocated for the NVDRS, which is the National Violent Death Reporting System. And it's a uniform system of reporting deaths across the country. There are now, we had 18 states, and there's now funding for 32 states. And what that's going to do is give us a clearer picture of how people are dying by suicide. And not only will it take death certificates, but it will also take information from hospitals and counties and compile all that information so it's more uniform across the country. And that will help us, again, come up with what programs and services we need right in the community. So we often look at what bills, our senators and assembly members are working on and what we can get behind to advocate that will help with both mental illness and suicide prevention.
Did many people see a need for that? Because in the past, have a number of suicides perhaps been not reported or not necessarily tallied, and if you didn't keep track of how many you have, you really don't understand the scope of the problem.
There's a huge underreporting of suicide, as we can tell. So for example, in New York State, every county in New York State had a different way of reporting a suicide death. So some counties would not report it as a suicide death unless there was a note left, and we know that a lot of people don't leave a note. So as those numbers become uniform across counties, across states, across the country, the numbers may continue to rise until we get a better handle on how things are reported. We also know that things like drug overdoses or single car crashes wouldn't often be reported as a suicide, though in some cases they could be.